the vagus nerve activity helps release a neurotransmitter that calms us. It also stimulates immune cells that keep us healthy. And that becomes a positive feedback loop. You take a deep breath, you get even more relaxed. You stimulate your immune system. You release a neurotransmitter that calms us. And that in turn encourages us to take another deep slow breath. Pretty amazing. Okay, so that's basically what I said. It's that PNS is the parasympathetic nervous system. Okay. The vagus nerve controls digestion, so you should be relaxed when you eat. And this abbreviation, low vagus nerve activity, that's low vagus nerve activity, is a fundamental factor in disease. We know this scientifically. If you don't take slow, deep breaths regularly, it's a contributing factor to disease, to the onset and progression of a range of chronic diseases. If people knew this, they'd be taking slow, deep breaths all the time. When we have high vagus nerve activity, taking slow, deep breaths, it releases acetylcholine, which calms us. It triggers anti-inflammatory pathways, which is good for our immunity. Helps to moderate tumours and reduces the risk of chronic disease. This is so simple, so fundamental, and it should be taught to everyone from the age of 5. I'm not going to get on my bandwagon. Okay, if you're interested in knowing more, there is a link, a YouTube link for you. We're not going to watch it now. Here's the diagram. Okay, so here is a relaxed diaphragm. The lungs are at rest. As we take a deep breath in, using the diaphragm, contracting the diaphragm, look at what happens to the lungs. Compare the size of the lungs here to here. Okay? So using the diaphragm, contracting the diaphragm down enables us to take in more oxygen, which gives us more energy than anything else. Okay, everyone's happy with that? This is what happens when we take a slow, deep breath in. This is what happens when we take a slow breath out. And don't forget, ideally, it's in through the nose, out through the nose, but in through the nose is more important. Okay, so we've just taken a slow, deep breath and we've contracted the diaphragm. Now we relax and exhale slowly, and the diaphragm relaxes back to that phenomenal dome-shaped huge muscle, and it helps to push the carbon dioxide out and reduce the size of the lungs. That's what taking a slow, deep breath is all about. So I'm going to, before we go any further, I'm going to come back to that question that I asked at the beginning. If you want to get through a really tight spot between two walls, where you've parked your car next to the garage door, you can get out, but it's a very tight squeeze. What did you say you would do? There were numerous people who said breathe in. Okay, now tell me what you do. Unmute and tell me what you would do with this new information.
Breathe out.
Breathe out.
Breathe out. And that very question, I've asked thousands of people that question. Where's my hand? 6 people have got it right. Okay. Again, proof that most people don't know how to take slow, deep breaths. Everyone thinks breathe in and get smaller, whereas we should breathe in and expand. We want to take in as much oxygen as possible. So here is how you are going to practice. Now, before I go to the next slide, what is important is that you're going to practice slow, deep diaphragmatic breathing twice a day for the next 2 weeks. And you're going to pick 2 times a day to dedicate yourself to 5 slow, deep breaths. The best time is when you hop into bed at night. Lie on your back, shoulders are down, spine is straight, and you take, I say 5 slow, deep breaths. You can take 1, you can take 10, whatever you're comfortable with. And then whether it's in the shower in the morning or on public transport to work or when you're at the checkout or when you're, you know, mute the ads on commercial TV and take a 5 deep breaths. I want you to come up with 2 dedicated times to take 5 slow deep breaths each day. I'm asking you to give up between 2 and 3 minutes. That's it. Okay? And you will notice a difference after 2 weeks. And very often what happens after 2 weeks is you'll catch yourself thinking, I just took a few slow deep breaths without meaning to. Because the autonomic respiratory system takes over from the controlled respiration. Because your 30 trillion cells, actually 30 to 40 trillion cells, have had extra oxygen for the last 2 weeks, and they like it because they're supposed to have extra oxygen, lots of oxygen. And so then the respiratory system kicks over to autonomically taking slow breaths. Phenomenal. So let's look at doing it. Whether you are sitting, standing, or lying, you want to have a straight spine. So for the purpose of tonight, if you are sitting, you bring your buttocks back in the chair. If you want your buttocks right back in the chair and you want to have your feet firmly planted either on the floor or a book or something, because it's very difficult to maintain a straight spine if your feet aren't planted. So those of us who are vertically challenged might need a footstool thing. You can, and I recommended initially, to have one hand on your belly and one hand on your lower ribs beneath your chest. Your shoulders are down. Taking slow deep breaths does not involve this. Okay? This is not helping. This is just contracting upper fibers of the trapezius. Doesn't do anything. Okay, so ideally keep your shoulders down. And these are the 4 words that you are going to commit to. Inhale and expand, so you want to get bigger. Exhale and release. You can say exhale and let go. You can say exhale and sink down. I quite like sink down because that gives you a better picture of getting smaller. And the reason that your hands are on the belly and ribs is so that you can feel your torso getting bigger as you inhale and sinking down towards your spine as you exhale. Okay, so if you think inhale big, exhale small, if that helps. All right, somebody's already got their eyes closed. Yay, Susan. Right, let me leave that. Now this next slide, I'm going to get you to close your eyes in a minute. This slide is a beautiful handout for your clients. Now what I've taught you is you're not ready to use this clinically, but I do recommend this slide. Print it out, put it on your fridge, put it in your office, put it in the staff room at work, wherever. Because it's the simplest diagram to show what to do. Okay, and it is good to bend your knees when you're lying in bed because that takes the pressure off the lumbar spine and softens the abdominal musculature. All right. So
Judy, we're just about at time for the breakout rooms now.
is 1 more minute?
Yes.
Okay, let's take a slow, deep breath. And this next slide is another one. Here are your simple instructions. Inhale, expand, exhale, release. So, if you're comfortable, close your eyes. Make sure your spine is straight. If you're comfortable having your hands on your torso. Now, what's really important is that two things are really important. You breathe at your own pace. If I'm saying inhale and you're still exhaling, that's fine. And if you get dizzy or lightheaded, stop the deep breathing, go back to normal breathing. All right, I'm going to take you through it for the next 30 seconds. Make sure you're comfortable at all times. As you inhale at your own pace, expand. And breathing at your own pace, letting go, sinking down as you exhale. Your own comfortable breaths at your own pace. Expand as you inhale and smoothly, softly get smaller, sinking down. Exhale. In your own time, at your own pace, take 4 more slow, deep breaths. Expand as you inhale, letting go as you exhale. Once, there's no rush, once you've finished your 4 slow, deep breaths, keep your eyes closed and do a quick little reconnaissance as to how you feel physically and emotionally. Just check in and see how you are. And when you're ready, there's no rush. Very gently open your eyes in your own time. Good. And is everyone okay? Might unmute. Yep, yep. If you have a question, please unmute and ask. And did anybody get dizzy or lightheaded?
No.
Any questions at all before we go to the breakout?
Judy, I have a question.
Good.
It's Christine here.
Christine, hi.
I noticed you said to breathe in through the nostrils and out again through the nostrils. In my yoga, I was taught a yogic breath, which is in through the nostrils, out through the mouth. Is that, is it important to breathe out through the nose, or?
It's a good question. What I teach is purely anatomical breathing, biomechanical breathing. It's not pranayama, it's not yogic breath. It's always important to inhale through the nose. for those three reasons. It moistens, warms, and filters the air. Whether you exhale through the nose or the mouth isn't so important. And in yogic practices, there are different effects.
Okay.
The rate, the rhythm of the exhalation, and whether it's through the nose or the mouth. But all important to inhale through.
Yeah. Thank you. Thank you.
Thank you. Any other quick questions before we break out? Yes, Carmen?
All right, Judy, what would you like them to do in the first breakout room? We're running a little overtime, so the breakout room might be a bit shorter. What would you, in fact, I think we could have one breakout room and then come back to Q&A. What would you like them to do in the breakout room?
What I'd like you to do is discuss how you would introduce this clinically. Now, I haven't taught you enough to do that yet, but I think it's a good start. What kind of clients and how would you convince them, now that you know that it's evidence-based, how would you talk to them about the importance of deep breathing? I suggest that you don't use any words like diaphragmatic or respiratory or evidence. You say, research has shown us that this is so good for anxiety, for depression, and make it relevant to them. And then certainly whether you practice diaphragmatic breathing, whether you've learnt any and whether you have included it. And then we have that handout if you, I don't know who's read it or not, but there's enough information there, I think, for you to it's not long to read. If you haven't read it and discuss. And I'd like you to talk about the kinds of clients you think this would be really pertinent, but also if you want to share, how would you benefit from it? And perhaps when. That should be enough to go with. There are 2 attachments, so have a look at those in the breakout.
Okay, so we'll do 10-minute breakout rooms, and I'll allocate those rooms now, and there'll be a countdown before that.
Is it only 10 minutes, Carmen? Are we doing?
We could do 15, then we've got a 5-minute for Q&A.
Okay, 10, 12 minutes.
10 or 12 minutes?
Yeah.
Great. Okay.
Terrific.
Just ask everybody to join your room now.
We are hearing you, Judy. It's all good.
Yeah.
We can hear you.
All right. Does anybody have any questions to ask?
I have, Judy. This is Susie. What's
Hi, Susie.
what's the youngest age group that you could try this on?
There is no in any age group from newborn to very old age. If you want to work with babies, a really good way to do it is to have the baby on your chest and you take the slow, deep breaths, and they will line up with you. They will synchronize with you. You can have a baby or a child lying on their tummy, and you put your hand, the baby lying on their back, you put your hand on their tummy and see, you make a game out of it. Can you push my hand to the ceiling? So your hand is on their tummy, and as they inhale, they try and push your hand to the ceiling. And as they breathe out, you don't say inhale, exhale, you say breathe in, push my hand up to the ceiling, breathe out, bring it back down to the bed. So that is a good way. There's no limit to the youngest or the oldest. It's using the right terminology. With children, a really good way is to get them to put their favorite soft toy on their tummy. And okay, now lift Teddy to the ceiling, bring Teddy back down towards the bed. They love that. Using the imagery of a balloon is ideal. Make the balloon big with more air. Make the balloon smaller as you breathe out. So they're good ways to work with young children.
Do you ever get adults to lie down on the ground?
I run relaxation classes, so yes. If they're comfortable, I check that they're happy to lie down, preferably knees bent. And then what I often do, I never leave them. You're with them all the time, and you might have a stool or something that they can lean on to get up if they're not very agile.
Do you find that's the best way to teach people, lying down?
You will find tonight when you hop into bed, compared to sitting, it is much easier to take a deeper breath while lying, and preferably with the knees bent. It's much easier.
Yeah.
You don't sort of have the gravity, I guess. I don't know.
It is just controllable, much better controllable when you're lying down.
Much better control, and people don't tend to do that when they're lying down. Yeah.
100% concentration.
The quality of the sound is poor, but ask away. We've got a few more minutes. And then I want to have 1 minute at the end just to finish up. Any other comments or questions?
Judy, just wondering why for some clients it doesn't seem to work as well.
The which doesn't work as well?
The breathing, the deep breathing. Many clients for me it does, but there seems to be a group for which it doesn't. Let me just...
A group of people it doesn't work for?
Yes, yes.
Okay. And this, in terms of applying it clinically, it's difficult because we simply don't have the scope to cover it properly. People who have PTSD or traumatized, hypervigilant, hyperanxious, commonly find it difficult to take slow, deep breaths. It's threatening. My experience is one slow, deep breath is a great start. And even clinically, if it's one slow, deep breath once a week with you, they don't even have to practice it at home, but over the next 4, 6, 8 weeks, they're going to take 1, maybe 2 slow deep breaths with you in the clinic. And then when they're comfortable with that and they know that they're not going to have a panic attack because of 1 slow deep breath, they can start to take a few more. I think it's depending on the environment and reason for the session. Yeah, definitely. I can't see all of that.
Judy, if you've got a really anxious client, is there one thing that you would specifically do to help them take that step to a deep breath?
Oh, look, it's, I would encourage them. So I do tell them that we know it works from research and from experience. They can go as slowly as they like. So what I have found is that taking 1 slow breath once a week, with you is, or, is enough. Don't worry about practicing it twice a day for 5 deep breaths. They're not up to that yet. But if you can encourage 1 deep breath, and they can have their eyes open, they don't have to have their eyes closed. Slowly. You can then explain some of the things. I mean, it depends, I guess, and every client is different. If you think that they're up to, if it would help to understand some of the mechanisms, then talk to them about this major nerve that actually starts to help us relax if we take 1 deep breath. It can then do its work better to stimulate the parasympathetic nervous system or encourage us to be calm. So you can tell them that there's a lot to look forward to, that we can start with 1 breath once a week with me in a safe place, and build up from there. If somebody has been hypervigilant and anxious and traumatized for 20, 30, 40 years, it's not going to happen overnight. I think, baby steps. There isn't a human being who can't benefit from learning to take slow, deep breaths. And even if it means taking 1 slow, deep breath once a week. We have 1 minute left. Any burning questions? All too relaxed?
Judy, I'm wondering if you could just say a little bit about what you might cover in the full day one, because we are sending out a special offer to people after this, if they were interested in going a little deeper.
So the focus of the 1 day is I give you more of the theory, more of the research, but I teach you how to teach your clients. And we haven't covered that. So what I would encourage you after today is practice for yourself to take slow, deep breaths, and you learn what's difficult, what's threatening, what's the best position, what's the best time. But we look at more of the research. We look at psychoneuroimmunology, which is understanding how the mind and the body are connected. So psychological mental health is improved by physically taking slow, deep breaths. And we do breathing and guided imagery. We look at the combination of those two, how to teach it, and then you actually have a little bit of a practice of teaching, even though it's online, which is a challenge. So I think I've got up here a slide that says what we have not discussed today. We haven't looked at the principles of relaxation as therapy. That's important. We haven't looked at the principles of teaching relaxation, guided imagery and breathing. We haven't looked at things like contraindications and cautions. So important things for clinical application of these techniques. Both Carmen and I encourage you to take up on this amazing discounted offer for, it's Saturday the 27th of June. Somebody wrote in, and I know it's 6:31, wrote in, some people find feeling calm threatening, and that's the sort of thing that we discuss in the 1 day as well.
Great. Thank you, Judy, and thank you everyone for participating this evening. Once the session ends, I'm sending an email out to everyone with, it's actually a 50% discount if people would like to go further with this and attend Judy's training. And there's also another training discount that we're going to give you as well, just as a part of this Thrive community to help you at this time when it's been quite tough for everyone. So really lovely to see so many people here. And we will have another Thrive session in a couple of weeks, so keep an eye out for it. Judy, thank you so much for this evening and for your contribution. And thanks to everyone. Have a lovely evening.
Thank you. Thanks.
Good night. Enjoy your slow, deep breath practice tonight. All the best.
Thanks.
Thank you. Will do. Great. Yeah.
Night.
Thank you.
Thank you.